Hello and a very good evening to all our viewers on Facebook's News 9 page. And today I will be speaking about India's current tally, which has now crossed the 1.5 million mark. Well, India raced towards the second spot in the list of nations hit worst by the COVID-19 pandemic, crossing the 1.5 million mark on Tuesday evening. And the total figure in the country is currently over 15 lakh, and Brazil is currently at the second spot with 2.4 million cases, preceded by the US, which has close to 4.2 million cases. And overall, 16.5 million people across the world have contracted the disease, with close to 6,54,860 fatalities. And now a 7-day moving average of the fresh coronavirus figures indicated today that India is increasing its tally at a rate of 3.6%, significantly higher than US at 1.7% and Brazil at 2.4%. So if the rate is not brought down, India risks surpassing the US in just a little over 2 months. And on Monday, the Prime Minister Narendra Modi said that India is currently in a better position than other countries because of the right decision at the right time. And he was referring to the lockdown which was called in or enforced across the country during the initial stages of the COVID-19 outbreak in India. And this particular data in India has mostly been fed by the increasing numbers from southern states of Andhra Pradesh, Karnataka, Tamil Nadu, and even western states of Maharashtra as well. So the number of fatalities from the disease stands at over 30,000 in the country. And Maharashtra, as on 29th of July, the active cases stand at 1,44,998, whereas the recoveries stand at 2,32,277, and the deaths have currently risen to 14,165. So the total number of cases in Tamil Nadu is also currently over 57,000, because recovered cases stand at 1,66,956 and the deaths have risen to 3,659, and the total cases in Tamil Nadu is currently over 2,27,000. And Karnataka is no different because it has the second highest number of active cases in the country. And as of today, the active cases in Karnataka are currently at 64,434, whereas the recoveries stand at 40,504 and the deaths have risen to 2,055. And the total cases in Karnataka stands at 1,07,001. And now speaking about Delhi, it has the third highest number of COVID-19 cases in the country. And according to the latest data, Delhi currently has over 10,000 recoveries, and the deaths have risen to 3,881. Well, the total number of cases in Delhi stand at 1,32,275. So now let us quickly go over to Dr. Satyanarayan Mysore, who is currently joining us in this live interaction. A very warm welcome to you as well, Doctor.
Thank you.
So, Doctor, now that India has crossed the 1.5 million mark with over 40,000 fresh cases, is this the peak or is the worst yet to come, Doctor?
Unfortunately, so every mathematical prediction, whether it is SEIR or the CMC Vellore ex-professor prediction or other mathematical modeling, which looked at number of cases per day and calculating how many days it would take to reach a particular figure. It appears that everyone is wrong, and the pandemic seems to be a winner in terms of nullifying the prediction. Let us look at two figures. Initially, it was projected based on other modeling that in Karnataka we would have low numbers would be like something like 87,000, or a higher number would be 2,99,000. But now there are other members, organizations that have said if we take 10% of the 138 crore, then we would have a huge number of crores of people getting infected. So I don't know whether this is the peak, but we are slowly inching towards the peak. Do I want the numbers to climb up to reach the peak? No. as much as possible, we should, try and break the transmission and figure by test, trace, and treat philosophy.
Also, doctor, now that we are in the monsoon season, and since this particular season is very rich in vector-borne diseases, do you think COVID-19 would aggravate the current situation in the country, doctor?
COVID will not be that much dependent upon the temperature and seasonal changes, but definitely, given the monsoon season, we will have the winter viruses, which are adenovirus, influenza virus, rhinovirus, respiratory syncytial virus, all these diseases, which will present in the same similar manner as COVID. Therefore, it will become a huge diagnostic challenge, the challenge for patients and healthcare workers and hospitals, because you don't know if this is COVID or it is influenza, and both present in the same way. But the amount of isolation precautions may not be may not be as much as you would do for COVID, that you would want to do for influenza. So it is going to be a diagnostic and situational nightmare. Having said that, given that there are no schools running, there are no malls running, I think the amount of influenza and other droplet infections are going to be less.
Also, doctor, now with the COVID-19 cases crossing 1.5 million mark in India, do you think the government should allow opening of theatres and gyms, given the kind of situation that is prevalent in the country and also in the state, doctor?
I would take an independent stand and say no to opening, gym and theatre. The simple reason is that in the peak of the pandemic, one should take every single precaution. If we are to learn from the 1918 to 1919 Spanish flu, once the first wave came down, people, broke into celebrations, and it was different issue altogether when the second peak hit. So I guess we need to be very cautious about opening, theaters. If you are closing the schools, then why open the theater? Gym could be opened with a lot of restriction, and obviously people who are into serious gym will not be able to wear mask when they are in the gym, when they are doing workout. So you can imagine what could be the situation if there is a unknown positive person in the gym.
Right. Also, doctor, I've been receiving a lot of questions as to how useful will favipiravir tablet will be for treating, COVID-19 patients with mild symptoms. Now that India's hetero labs has secured the approval from the medical agencies to, sell these tablets in medical outlets, how do you think this will benefit COVID-19 patients?
Point number one, there is no kind of evidence base so solid for flavipiravir to be used in COVID. Flavipiravir is a drug that was kind of developed, invented, and brought into use for influenza, against influenza by Japan. However, in this pandemic, flavipiravir was being used by all the other countries, and the funny thing is Japan itself has not listed or approved this drug for treatment with for COVID. The evidence base is extremely weak. If you want to do a PubMed search, punch in flavipiravir, and not a credible paper comes along. There are papers that talk about safety profile, but do they talk about efficacy? I think there should be renewed vigor in looking at evidence-based medicine and not trying to sell a product because it will sell like a hotcake in the pandemic. and that applies to any and every drug.
Okay, doctor, and also since now I also told you about the monsoon season, now people are worried whether, even the general cold and cough also could, come out as symptoms for COVID-19. So how do you, educate people to stay calm and also not, worry too much about just a normal common flu?
So we are trying to, do webinars and, involve community leaders, try to encourage, influenza vaccination in the first place. The current pandemic discipline and vigor, like, hand hygiene, taking care of, mask, using mask, physical distancing, these things will limit these infections largely.
Right. Also, doctor, and how long is India away from, coming out with a vaccine? Will we see a vaccine in the nearest future, or is it a distant dream?
I am banking on the Moderna vaccine, and AstraZeneca seems to be keen to get it to India. They are into phase 3 clinical trials. So everyone, I'm sure, is looking at the vaccine enthusiastically. Having said that, again, unless and until safety and efficacy are established, I would not be enthusiastic. The timeline of getting it early should not come at the cost of developing something that may not do the expected, result, or may end up harming more than what it is intended to, do.
Also, doctor, now that there wouldn't be a lockdown in Karnataka ever again, as the chief minister has claimed, how do you think, how do you think people can stay safe during a time when the cases in Karnataka are set to, reach a higher number?
So, the question is that are we doing enough? We see people, patients who are admitted and the relatives who should be in quarantine are, walking around freely. There are a number of people who are questioning and saying there is no COVID and coming up with conspiracy theories that COVID is a tool to, make money. These kind of things have no meaning, no logic. But on the other hand, we see number of stigma attached to COVID. RWAs or people at large don't tend to be helpful. So I think we need to break all this barrier. We need to reduce the stigma on COVID. We need to clear this misgivings on COVID and follow the commandments of wearing masks, physical distancing, hand hygiene, and potentially consider everyone as infected. And that is the way we can bring down the numbers during the peak. Everything cannot be dependent upon the government of the day alone. It should be, community effort.
Right, doctor. And also, doctor, recently we also witnessed a solar eclipse. And if you saw outside on the streets of Bangalore, you could hardly see any people because there are a lot of, blind beliefs associated with it. But when it comes to COVID-19, people don't seem to be serious at all. For them, solar eclipse is, much more harmful to them as they claim. And COVID-19 is not at all serious. So what can people, do at this particular juncture, doctor?
I guess we should, work towards raising the awareness. Even that I'm not, very confident because by now 6 months we have dealt, 6 to 7 months I should say, we have dealt every day in the social media, in the television, mainstream, print media, so many things, talking, sense about, COVID and how to prevent and, why to prevent and economic issues. But then some people or a section of society hasn't learned, and still I think we should keep up, at a community level to build up more awareness.
Right, doctor. Thank you for joining us with all those insights. Well, that was Dr. Satyanarayana giving us all the insights on how people can stay safe and also about how soon or how late a vaccine is from reaching the people. So till then, at a time when we don't have vaccine, News 9 has been stressing upon one particular point, and that is taking precautionary measures and also following all the safety protocols. So this is the only weapon that we have against the invisible virus as of now, and we hope that the people of Karnataka and also people of our country follow all the safety and precautionary measures to stay safe at this point of time, because the COVID-19 cases are only set to increase in the coming days as the reports claim. So this is the very crucial time for us, and it is very important for us to stay safe and also not venture out unnecessarily without any formidable reason. So people, please do take all the precautionary measures, stay safe, and also keep the lives of people around you as well safe and sound. With that, it will be a wrap on this live interaction with all our viewers on Facebook and YouTube. Please, on the other hand, please also follow News 9 on all social media platforms. Thank you for watching.